Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? This is Christian Brindle, wherever you are and however you might be listening to me today. Thank you so much for taking the time. Folks, this is episode 241 of the Everything Medicare Podcast. If this is your first time tuning in, my name is Christian Brindle. I'm your host. Every single week, I bring you a podcast where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. And folks, we were off last week. We're too busy to bring you an episode this past week. And I apologize. That is not what we typically do. That is not our mission to ever miss a week. And I do apologize about it. And I appreciate your willingness and patience to continue tuning in each and every week. I don't take that for granted. I feel like we have the best audience in the entire industry. And I don't say that lightly. I feel like we do have the best audience that anybody could possibly have for this show. And you, this wonderful, terrific audience, is why I keep coming back week after week after week. So let me start with this, folks. I have done episodes, videos on YouTube, whatever type of medium you'd like to talk about this in the past, but I felt like it would be appropriate if I addressed it specifically on this platform. And what I'm talking about is the litany of commercials, celebrities, typically retired football heroes like a Joe Namath, a Mike Ditka, a Joe Theismann, that are popping up on your TV screen and probably have for some time. Let's face it, this isn't new. But I do believe the amount of times they're popping up on your TV screen is more than ever. And one thing you'll notice in years past, a lot of times, those commercials, those ads, they typically really picked up during the Medicare annual election period, which is October 15th through December 7th. And then you saw them continue to air, but they died down a little bit in the off season. And when I say the off season, I mean outside of open enrollment, outside of the annual election period. There is 2 time periods every year you can change your plan. October 15th through December 7th, that's the annual election period where essentially it's a free-for-all. You can change your Medicare Advantage plan to another Medicare Advantage plan. You can change your Medicare Advantage plan to original Medicare with a drug plan. You can change your prescription drug plan with original Medicare to a Medicare Advantage plan. It's kind of like a all over the place thing. You can do whatever you like, almost, for the most part. Then you have what's known as the Medicare Open Enrollment period, which goes from January 1st through March 31st. And that's more geared towards people that are already on Medicare Advantage plans. They can change one time from either an Advantage plan to another Advantage plan, or they can change from an Advantage plan to original Medicare with a Part D drug plan. However, with OEP, open enrollment from January 1st to March 31st, insurance companies, brokerages are not allowed to advertise that, although not everybody follows that rule, mainly due to the fact that plans do not change in the middle of the year. So what do we have now? We have a litany of cookie cutter advertisements. They're all saying the same script. Are you getting all the benefits you're entitled to? How many times have you heard that one? New changes in the area might affect your enrollment. How do they get away with doing this? Because I got news for you, folks. What they're advertising, which is Medicare Advantage plans, they will never, advertise a Medicare supplement because their bottom line is Medicare Advantage enrollments, because that's where their money is made. The government funding is tremendous for them, and that's where they're going to push you into. But they're advertising Medicare Advantage plans. We all know this. They're not advertising anything unique or special that you can't get anywhere else. I got news for you. Any single one of these companies that's advertising has usually just 3, 4, maybe 5 of the biggest name insurance companies that do business in the Medicare Advantage space. I won't name any names, but you can probably use your imagination to discover which insurance companies I'm talking about. They're not going to carry a majority of your options. It's the first problem here. Second problem here is you'll notice they advertise all year round, making it sound like there's just been a change, when in reality, Medicare Advantage plans are exactly the same from January 1st to December 31st. They announced the changes October 1, year in and year out, and those changes don't take effect until January 1st of the following year. But here they are in April, May, on the television, talking like there are changes when none exist. What do we call that in the business world? A bait and switch. But if we're going to talk about bait and switch, let's talk about what they're actually advertising. What is their hook to get you pulled in, drawn in to call them? Now let's talk about for a second before I get into that. Who are you talking to? Are you talking to Joe when you call Joe Namath? No. Folks, wake up. Joe is reading a teleprompter. He doesn't know what he's advertising. Joe doesn't have a Medicare Advantage plan. It's public record. Google search it. Joe has a Medicare supplement that's paid for by the NFL as part of his pension. Joe's a paid sponsor. They hand him a blank check and say, read this, dude. And he says, what am I reading? They say, don't worry about that. He says, okay. Wake up. These are companies that are call centers when you're calling somebody. You're being routed to a call center, a meat grinder, a revolving door type organization. Now, I've beat up on call centers a lot over the years on this platform. I have friends that run call centers. Not every call center is operated this way, so nothing is a blanket statement. But these TV commercials that you're calling that route you to the call centers, the 1-800 numbers, the Joe Namath commercials, all of them, they route you to a call center where the person you're talking to probably just started that week. They're taking calls from all over the country, 50 states. They put your zip code into a quoter, and they're looking at the plans in your market for the very first time. What have I said before about Medicare Advantage plans? A Medicare Advantage plan is going to be different in all 50 states. And depending on one part of the state opposed to another that you might live in, the plans might be completely different in another part of the state. Look at a place like Florida or California. It's almost like 3 or 4 different states mushed into one in terms of how many different plans are available. Plans in South Florida are dramatically different than plans in Tampa Bay or Jacksonville, if you're in Florida. So it can get kind of confusing for a lot of people when you're dealing with plans in all 50 states. They're going to be dramatically different. Now, how are they different? The benefits are going to be dramatically different from one place to another. In one state, a Medicare Advantage plan might come with no drug coverage, and then in another state, a plan with the same name will have drug coverage. The hospital systems. Medicare Advantage plans have networks, and they are on such a sliding scale. Networks meaning lists of hospitals and doctors that you have to go to. And they're going to be on a tremendously sliding scale. Some plans will have great big networks that give you all types of choices in terms of where you can go, in terms of the hospital and the doctors in your specific area. Other plans are going to have itsy bitsy tiny networks. And I got news for you, folks. Every insurance company, without exception, has states where their network is strong and has states where their network is weak. There's not one insurance company that's awesome all 50 states. Not one! But when you call these call center folks, there are people that are in a call center somewhere. I guarantee they haven't been working that long. When I say a revolving door, I mean they have people come in and out and in and out and in and out and in and out. Meat grinder, as we call it in the insurance industry. They're typing in your zip code for the first time. They're looking at the plans in your market for the first time. And they're trying to make a very quick snap decision. And they're trying to sell you one of the 3 or 4 big name companies they have, even if it's not in your best interest. And they don't know the hospital systems in your area. Sorry, they have no freaking idea. They don't know which plan is a big network, a small network. They don't know. They're taking a look at it and they're like, okay, this company, this usually is a good company. I sold a plan in, the other side of the country the other day and it seemed to be good. I'm going to sell that same plan. You know how I know this? I've called these places myself. There's videos of me on our YouTube channel calling these places. Go look them up. Listen for yourself. These are eggheads, morons, incompetent individuals that don't know a thing. And when you call these places, that's who you're putting your trust in. And I know people are doing it. Why? Because certain of these groups, and I'm not going to name any names just because I don't want to get myself in trouble, but certain of these groups, these call centers, get in trouble yearly by the Centers for Medicare and Medicaid Services. In fact, last year, one of them in particular, one of the big name ones, they got fined $25 million for misrepresentation of what's really available. But I got news flash for you. I also read they made $125 million in revenue. So to them, it was like a speeding ticket. The government doesn't shut them down because they can fine them and make all this money. It's a corrupt system that they allow this to go on. That's really at the end of the day what the story is. Now, how do I know this other than just my own experience? I've had multiple clients of mine call these places. And people ask, well, why would someone call these places over there with you? Are you not doing a good job? No, it's not that. It's that people see something over and over and over again. Some of the people are going to call. We have a 99% customer satisfaction rate. Doesn't mean it's 100. I wish it was 100. I don't always know what the issue is with the people that's the 1%, but I don't know things unless someone tells me. But what are they advertising on these commercials? They're advertising things that you can't get. Newsflash! Things you can't get. They're advertising things like you can get $145 back in your Social Security check. Read the fine print, folks. I have a YouTube video that's kind of gotten picked up I'll give a bit of steam called, what is it called? It's called Exposing the most predatory commercial ever aired. And it's a Go Medicare ad that says you can get $145 back in your Social Security check. In the fine print, I go through the commercial in the video, I show it to you, I read it to you. It says in the commercial, in the fine print, you have to qualify for your state's Medicaid program. What is Medicaid at, you ask? Medicaid is for people that are in low income brackets, in poverty brackets, and it's a subsidy you get from the state you live in. It has nothing to do with any insurance company or any insurance brokerage. It's irrelevant. The state, what it is if you qualify for Medicaid, the state you live in is going to pay sometimes your Part B premium for you, which is $148.50 a month this year. That's what they're talking about. That's what they're advertising. But they're painting the picture. They're creating this narrative that there's a super secret plan out there that will do it for you. Nope. No way. And how many people have called them about this super secret plan and they're like, oh, you don't qualify or it's not in your area, but let us sell you this instead, which is just essentially the same plan you have now, but a little worse. Bait, and switch. The other thing they advertise is in 1 or 2 states, there are plans that actually have what's known as Medicare Part B givebacks. We've done episodes about this before, and we'll probably do an in-depth episode about this next week. What a Medicare Part B giveback is it's when a Medicare Advantage plan refunds a portion of your Medicare Part B premium. A lot of times it's 20, 30, 40, 50 bucks a month. In some states like Florida, you can find plans that do 100 to 130, maybe even the full Medicare Part B premium. There's one plan in Florida that does the full Medicare Part B premium. It's a plan that has no doctors in the network. It's not good in other areas, but it does the full Part B premium give back. Because that one plan is available and it exists in one state, doesn't apply to all the other 49 states. There's companies that run commercials saying that depending on where you live, this could be available to you, and they know it's only available in one select place. But they justify it by saying it's in one place, so they advertise it everywhere. And then when people call in, they're like, oh, sorry, that's not available in your area, but let us sell you this instead. It's predatory. It's misleading. It's disgusting. And I'm going to war against it. I had a client of mine this past open enrollment period. She was on a plan with me. And it was her best plan based on her prescription needs in the area. It was impossible to do better. And that's always the way it goes when someone does business with us. They're on the best plan. We make sure of it. But this specific individual took 3 different insulins. The 3 different insulins combined together would have been well over $1,000 a month retail cost if she didn't have coverage for them. With our particular plan, they were under $100 a month. Not too shabby, right? In copays. She had other drugs other than that as well. Her drug costs were enormous. So she calls up one of these commercials during this past open enrollment period in the fall, and they take a look, they punch the zip code in, and they try to sell her a plan that is with the same insurance company that I have her with, but it has what's known as a Medicare Part B give back, like I mentioned a minute ago, that refunds $50 a month back into her Social Security check. Wow, that sounds pretty good, right? Oh, nice. But what they failed to mention to her was that it was a plan that had no drug coverage. No drug coverage. It was a specific plan that was made for people that are veterans or federal employees or TRICARE for Life individuals, people that are able to get their prescriptions from another source. So it's a very niche plan. I'm well aware of it. We recommend it all the time to certain individuals when it fits. But for this lady, it would have taken all of her prescription coverage away and she'd be paying 100% out of pocket for all of her medications. Not only did they not tell her it didn't have drug coverage, they told her that it would cover her insulins at 100%. They lied. These are the kind of people we're dealing with. Horrible people that will throw you under a bus for a quick sale and then never talk to you again. That's the other part of this. When you do business with a call center, you can never get help on your plan ever again. The person that sold you the plan, you'll never talk to them again, ever. When you call back in, you're going to get a different person every time. It's like throwing a brick into the Grand Canyon in terms of hoping you'll get that same person again. 1 in a million. And truth be told, you won't. There's no customer service, 0. That's why these call centers lose 30, 40, 50% of their clients every single year because they have no service and they typically put people on the wrong plan. Almost always. They're incompetent. They don't know Medicare, but they're backed by Wall Street and they have a much larger marketing budget than anybody else does, so they pollute the airwaves and your television screens. That's the truth, folks. This is real. This is what it is. And the last but not least story that I'd like to tell you on this, another part of this that I'd like to essentially expose, a lot of them participate in illegal activities. What do I mean by that? Well, since they advertise all year round, there are people that call all year round. Well, like I said earlier, you can't change your Medicare Advantage plan unless it's during a select time, unless you qualify for some kind of special enrollment period, like a life-changing event. A lot of people don't qualify for that. But what they do when people call into these places, and I know this because it's happened with clients of mine, they'll call into one of these places, they'll put them on a plan that's worse They want to get back off of it. They realize that they made a mistake. They call me, and I can't do anything about it because they don't have a special election period. And I think to myself, how did they do? How did they get them on this plan? How did they do it? This person doesn't have a special election period. How did they do this? How did they change your plan in the middle of the year? And then we'll call the insurance company together, and I find out that they will lie on people's applications. They will lie on people's applications and say that they're just coming off of employer group health coverage. They'll lie on people's applications and say that someone just moved from another state, even though they didn't, and they've lived here for 20 years. They'll just make up a special election period, and the insurance company will just take it. They won't check. And they change these people's plans mid-year, and they lie on the application, which is a federal crime. Why does none of this get stopped? My best answer is this. There must be someone handing someone else under the table in high places a blank check to get away with all this. Because they get away with murder. They prey on seniors. Be oh so careful, ladies and gentlemen. Don't call these places. Work with a local broker. Work with somebody who actually knows what they're talking about. Even if you don't work with a local broker, work with a group like mine. And this whole thing wasn't building up to, they suck and we're awesome. We're not the only great shop out there, and I know that. Just work with somebody that's great. Work with somebody that's great. Don't do business with a call center where the person that is doing your plan for you isn't qualified to make you a milkshake at McDonald's and give you fries. Work with someone who's experienced, licensed, and qualified, and knows your market, especially if you're getting a Medicare Advantage plan. I would understand a little bit more if it was Medicare supplements they were slinging, because Medicare supplements are exactly the same plan in every single state. It's a little bit simpler. But Medicare Advantage plans range far and wide from one end of the state to the other. Be careful, folks. Be careful. And run the other way. Don't call these places. You will regret it. Anyway, folks, I hope you enjoyed this episode, and I hope you got something out of it. This was something that was weighing heavy on my heart. I had 2 clients of mine call in the last week, essentially calling these companies because they saw them on television again and again and again. And the information that they gave my clients was so wrong and so bad. They were asking for their Social Security numbers on the phone within the first 30 seconds. They were asking for their Medicare numbers over the phone in the first 30 seconds. How terrifying. Why do you need that? You don't need that. You don't need that to quote a plan. You slime balls. Stay away, folks. Anyway, folks, thanks so much for watching. Hope you enjoyed this episode. If you did, do us a favor. If you're listening on a platform that allows you to do so, leave us a 5-star review. Helps us a lot to reach more people like you that need to hear our message. If you're watching on YouTube, please do us a favor. Subscribe, like the video, comment on your thoughts. And our office works with people in about 38 states now. Those states can be listed down in the description of the show notes of the podcast or in the description of the YouTube video if you're watching this on YouTube. And our phone number is 801-255-5340, 801-255-5340. We would love the opportunity to be able to help you. One thing we've actually been able to start doing recently, too, to help more people in other states, so that way if they want to work with a local broker, they can. We actually partner with agents now in the great state of Illinois, in Alabama, in Texas, in Florida, in Virginia. We partner now with agents that are work with our organization, that we work with them, and they are incredibly trained and incredibly smart and incredibly kind and giving individuals. And they are essentially local agents that you can work with in your area if you'd rather work with someone in person. So even if you don't want to work with me specifically or someone in my office here in Utah, and you might be out way across the other side of the country, and you're in one of those states I mentioned, give us a call. I can help you get in touch with one of our agents that works in those specific markets specifically, and you can talk to someone in person. 801-255-5340, 801-255-5340. Thanks, folks. I appreciate you. And we'll be back next week with another episode. Have an awesome